Hello, welcome back to my channel. My name is Ruth and I am a hypnobirthing instructor and very busy mum of 3. In today's video, I'm going to be teaching you 2 very important breathing techniques that you can use during your labour and birth to help you feel calm, centred and in control. If you've watched any of my previous videos where I explain hypnobirthing in more detail, you will know that I talk a lot about the importance of relaxation and allowing your body to follow its natural process of labour and birth, and some of the things that we can do and the way that we allow fear to creep in or the way in which we breathe can have a massive effect on our body and the process of birth, and it can actually stop your body from moving forward. So hypnobirthing is all about learning tools and techniques in which you can support the process and you can support your body, but you can also stay in control. So before I go ahead and teach you these 2 breathing techniques, do go ahead and subscribe to my channel. I'm all about empowering couples and trying to help and support them to have a much better experience of birth. I am someone who has experienced a labour and birth with very minimal preparation, and I went on and learnt hypnobirthing and had 2 incredible, empowering births at home. And I want to share that knowledge with other couples so that they can also have a really confident experience, because I think sometimes it's all about the knowledge you have. And if you have the knowledge, you can work together as a team and have an incredible birth, no matter what happens. I'm also really passionate about teaching because I have used these tools and techniques myself, and I know that they work. So the first breathing technique that I'm going to teach you is all about helping you to remain calm, centered, and in control. Now, this is a breathing technique that you don't just have to use during labor and birth. You can use this during your pregnancy, and you can also use it beyond birth when you become a parent for any stressful situation in your life. The breathing techniques that I have learnt and that I teach couples one-to-one all come from the Calm Birth method. This is the company that I trained with. These are the breathing techniques that I teach. So if you want to learn any more about hypnobirthing or read a really good book or look back on the breathing techniques, I highly recommend that you purchase this book, The Calm Birth Method. So we call this breath the calm breath, and it's all about triggering your body's natural calming reflex. And this occurs when your out breath is almost twice as long as your in-breath. So the way in which we're going to do this is by breathing in for a count of 4 through your nose, and then breathing out for a count of 7 or 8, also out of your nose. But if you struggle with that, then please do go ahead and breathe out of your mouth. The most important thing to do when you're breathing out of your mouth is to make sure that the breath is slow and controlled, but also really focus on making sure that your jaw is also relaxed, because your jaw is connected to your pelvic floor. So during labour and birth, if you have any tension in your jaw or around your mouth, this could affect your pelvic floor and it could prevent it from relaxing and allowing birth to progress. The other important thing to note about this breath is that this is a breath that needs to be practiced daily. It's not something that you can just suddenly wake up and do on the day of your labour and birth. It needs to become second nature to you. It needs to be a tool that you can pull out of your back pocket and use during your labour very confidently to help you get to a place of calm. When we've seen women give birth previously, perhaps on TV shows where it's very dramatic, we're very used to seeing women kind of hyperventilating and breathing up in their chests, kind of like a panicky breath. That panicky breath is what triggers your stress response to activate, and that is what will release adrenaline into your body. We know that the hormone adrenaline is not something we want flowing around our body. That interrupts the natural process of labour. It stops oxytocin from flowing, and oxytocin is what we need in order for our uterus to contract. So we always need to bear in mind that our breath needs to be really nice and slow and in control. To avoid any breathing up in the chest, we need to make sure that our breath is really deep and coming from our lungs and from our abdomen. So when we're practicing, the best thing that we can do is place our hands onto our abdomen so that we can really feel it inflating, rising and falling. And we know then that there are no panicky breaths coming up high from our chest. When you first practice these breathing techniques, please don't feel panicked or stressed about not reaching particular counts or reaching full capacity yet. Again, this is the importance of practicing. So if you can only breathe in for 3, and then build it to 4, and if you can only breathe out for 6 or 7, then build it to 8. It's all about practice, but do what feels comfortable for you. You don't want to kind of be trying to reach that count. So yeah, just do whatever feels comfortable. But we'll do it together and I will count for you. So remember, we're breathing in through the nose and out through the nose if you can. It keeps it nice and slow and controlled. But if you can't breathe out of your nose for whatever reason, then just breathe out of your mouth. So the first time I do this, I will breathe out of my nose, and the second time I will breathe out of my mouth, just so that you can see both variations. Okay, so we are breathing in. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4, 5, 6, 7, 8. And it's as simple as that. So when that out breath is double the length of the in breath, it's going to tell your body to stay in that place of calm and that everything is okay. So you would use this breath at any point in your labour where you're starting to feel a bit panicky, a bit stressed, or if the environment that you're in is about to change. So perhaps if you're going from home to hospital and you start to become very aware that things are moving forward or that you are changing environment, using this breath in the car or when you get to hospital. Naturally, when you step into hospital, you release adrenaline. So as soon as you get taken to where you're going to be, or if you're sat somewhere waiting, use that breathing technique to get you back to a place of calm and to trigger your body's natural calming reflex. I think it's also really important to teach your birthing partner this breathing technique. They need to know it very well, because then they can observe you, they can make sure that you're not doing any chest breathing. If they need to help get you centered or back to a place of calm, they can do the counting for you. I certainly had moments of panicking during my labour, and having people around me that knew that breathing technique, that could do it with me, breathe with me, count with me, and help get me back to a place where I felt really centered and calm was really, really helpful. So practice this breathing technique every day, perhaps first thing in the morning, or practice it during your day when you are feeling very stressed. Perhaps you are in traffic, or there's something stressful occurring at work, or perhaps you have other children and you find moments of parenting quite stressful already. Use that breathing technique, see how it feels, and the more you practice, the more you'll get used to it, and it will become second nature to you, and you'll just be able to use that breathing technique very quickly whenever you need it during your labour. So the second breathing technique that I'm going to teach you, which comes from the calm birth method, is called wave breathing. It's called wave breathing because we picture our contractions a bit like waves. So rather than thinking of something that sounds quite harsh, like contracting, if we think of a wave, contractions are very similar. They build like a wave, they have a peak, and then they slowly fade away. So a contraction isn't a constant sensation of pain. The sensation builds, it has a peak, and then it dies away. So this wave breathing technique is where your in-breath and your out-breath are completely even to support the uterus and to get an even amount of oxygen down to that birthing muscle and down to your baby. So for this breathing technique, we are going to breathe in through our nose and out through our mouth. Again, we are going to be breathing deeply from your abdomen, making sure that your lungs fill and we're not doing any chest breathing. And as we breathe out, we're going to imagine sending that breath and that energy down your body and down to your baby. Now, as I mentioned, the in breath and the out breath need to be of an even count. So you need to start wherever you feel comfortable. In the book, it says breathe in for 7 and out for 7. But we know that lung capacity can be quite limited when you're pregnant. So you go to whatever is comfortable, just focus on keeping the count even. So you might only be able to get to 5 or 6, but just do what feels best for you. So I'm going to demonstrate. So as you can see, my shoulders are nice and loose and lowered. I'm not building up any tension in my chest or up in my shoulders. Keep everything very soft and relaxed, and just keep that breath nice and slow and control and even. It might help you as you're doing your breath to visualize something like a wave. You might want to actually visualize waves and imagining the build of that wave and how it falls, and that might help to keep your breath nice and slow and controlled and even. This breath is going to help you with that upward motion of your uterus as it rises, and then you're going to send your breath down to your baby. Again, this is something that needs to be practiced every day. The thing is, we don't tend to think about our breath. We just do it. We just go about our day just breathing. And I think sometimes as well, when we're stressed, we may not necessarily notice that our breathing pattern has changed. So now it is all about taking control of that breath and being very aware of it and controlling it and using it to your advantage. When you're practicing this breathing technique, I would suggest that when you practice it daily, that you do it for a full minute. So set a timer, because your contractions are going to range anywhere from 45 seconds to a minute when you are in active labour. So doing that breathing exercise for 1 whole minute kind of actually helps you to see that a minute doesn't actually last that long, and it gives you something to focus on. And so if you can do it for that full minute, you then have rest in between your contractions, and you know that you've got a tool that you can use to help you get through that 45 to 60 seconds of sensations that are building and then fading away. So get practicing these breathing techniques. As I said, they need to become second nature to you. You need to be able to, on the day of your labour and birth, just be able to switch and use these breathing techniques, and for them to feel really natural to you. Teach them to your birthing partners so they know the techniques, so that if you start to lose your way or you start to panic, you have somebody there that can help you focus, help you recenter, start counting for you, or start reminding you what the breath is. And then that gives you a focus, and you can get back to a place of calm, and you have something that you can be in control of as your body is doing what it needs to do. Do whatever is comfortable for you, breathing in through the nose and either breathing out through your nose or breathing out through your mouth. Practice, see what feels good, and on the day, do what feels good for you. And each time you practice, see if you can go that little bit further on your in-breath. What count can you go to? You might find that the more you do it, the more of a deeper, fuller in-breath you can begin to take with every practice. This is all about giving you a focus, giving you some control, but also signalling to your body that everything is okay, to stay in its calm response, to stay controlled, and to reassure your body that what is going on with your uterus and the contractions is very normal, and that it can continue to move forward. I hope you find these breathing techniques really useful. If you enjoyed this video and found it helpful, please do give it a thumbs up. I'm trying to reach as many pregnant couples as I possibly can. I want to help as many people as I can. And I know that hypnobirthing and birthing classes aren't always accessible or affordable to everyone. So I'm creating these videos so that I can give this information and teach people. Don't forget to subscribe to my channel so you don't miss any of my future videos where I teach more hypnobirthing tools and techniques and share more advice to help you have a better experience of birth. Thanks so much for watching, and I'll see you on my next video. Take care, bye-bye.